My name is Ijoma Omonia, and I'm a student of Bradman University. The nurse practitioner role is one of the specialties of the APN, that's Advanced Practice Nursing, that has increased in demand because of shortage of physicians. Currently, I am a nurse practitioner and I'm working in a reserved wellness center in Southern California. I am also a mother, a wife, and pretty much a student. I shall finish my program by 8, that's August of 2019. I understand my transition for DNP at the university will be relatively complex, but I intend to have a smooth transition through a clearly established timeline before and after graduation. Therefore, having a clear timeline for professional personal growth is essential and helpful. My vision My vision is to utilize the framework for transformation to bring patient-focused creativity and innovation to psychiatric mental health patients, utilizing appropriate guidelines to deliver excellent collaborative care with members of a healthcare team. And my mission is to provide timely, holistic, and compassionate care based on mentorship, primary prevention, and health promotion. I know definitely for sure that in the process of all this, getting the degrees and being in line working, that is going to be difficult. But I'm going to bridge the gap by going to the beach, exercising, going to church, still plan and organize my husband, like recognize birthdays in my family because I'm still going to be a mother, and my own birthday party as well. The much needed resources to help keep the balance is I'm going to utilize all resources from Bradman University. I'm going to utilize the libraries that we have. I'm going to utilize Google Scholar. We have out there for every need that I might have. And then I'm gonna make sure that I get 8 hours of sleep, regular exercise to keep mind and soul together, and read novels as well. And definitely, I'm gonna sacrifice going to Nigeria this year because it's like our tradition in the family. Every December we go home, but I'm gonna sacrifice going home this Christmas to finish up with my program and be able to meet the next plans in line for me. Usually, every summer is when it's my birthday. June is when I do my renewals of my licenses, my professional licenses, doing my physicals and all that. So past summer, I did all that. By fall this year, hopefully, I should have my CSP project approved, and I'll start working on them by January. And hopefully, by summer, I should be done with it and publish it to the library. Hopefully by same summer I will still have to renew my licenses as before and do my physicals and make sure I'm physically fit. By 2019 fall, I expect to have taken the psychiatric exam and passed, and by the end of the year, I should be working in a combining working in a psychiatric and doing the major one I'm doing with the underserved community here. I also have a plan of making sure to see if I can have my own practice. So with that, I am believing the goal is for 2022. So I am believing that before 2022, I should have applied for the licenses and started the process, and by 2022, it shall be a reality. Meanwhile, I will always continue to participate in continuing education as this will keep and help me develop my clinical expertise. Thank you very much for listening.